JABSOM class of 2024, parents and family, esteemed guests and faculty, I am privileged to be here with you today, albeit virtually, to celebrate your entry into the profession of medicine. While this event has been altered due to the pandemic, it is no less important. In fact, your restatement of the Oath of Hippocrates in a few minutes is perhaps more important than it has ever been. The Hippocratic Oath was written in the 5th century BC and is one of the oldest documents in history. While the creators intended it to be a binding covenant, modern doctors see the oath as a promise to uphold the art and science of medicine and act in the patient's interests. As medicine and society have changed, physicians have changed the oath to accommodate these shifts. Several phrases are particularly important in this time when we see so much suffering in our state, country, and across the world. As medical students, if you can approach your studies and each patient and family by trying to see the world through their lens, through their histories, framework, and circumstances, this will help you better ministrate without discrimination and care generously and honestly. Patient confidentiality now includes social media, HIPAA, and many other protections in this increasingly digital world. Upholding the highest behavioral standards for yourself and your peers also includes wearing a face covering or mask when you're not alone, adhering to physical distancing guidelines, and if you are going to eat with others outside of your immediate household social bubble, you need to do so more than 6 feet away. Thank you in particular for adhering to these last 3 guidelines. But let's take a closer look at the definition of the word ministration. It stems from the Latin word ministrare, or wait upon. In English, it stems from the word minister, attending to the needs, providing, and being a servant. Indeed, medicine first and foremost is a service profession, and it is what you all said in your personal statements. My hope for all of you is that you not only develop into excellent physicians, but also servant leaders. We, as your teachers, pledge to help you achieve that. So now, please join me in restating the Oath of Hippocrates, which is in your program. I swear by all I hold most sacred and before my family, my teachers, and my peers, that to the best of my abilities, I will keep this oath and stipulation. To honor all who have taught me this art, and in the same spirit of dedication, to impart a knowledge of medicine to others. I will continue with diligence to keep abreast of advances in medicine and respect those who broaden our knowledge by research. I will treat without exception all who seek my ministrations, discriminating against no one, so long as the treatment of others is not compromised thereby. And I will seek the counsel of particularly skilled physicians where indicated for the benefit of my patient. I will remember that caring for the patient will be my primary concern, and while doing so, I will honor the autonomy of the sick. I will recognize that such caring requires my being available, giving my time generously, communicating honestly, and comforting as well as treating. Such care also involves offering my support to my patients' loved ones. I will maintain all patient confidentiality and uphold the highest ethical, moral, and behavioral standards for myself and my peers. My behavior will always be honorable, thoughtful, and reflect justice toward all humanity. My fiduciary role will require protecting patients from all forms of malpractice, malfeasance, and unnecessary expenses, and I will try to prevent as well as cure disease. While I continue to keep this oath inviolate, may it be granted to me to enjoy life and the practice of the art and science of medicine, respected by my peers and society. May my faith strengthen my resolve to attain the above. Thank you very much, and best wishes on your journey.